Hello everyone. So let's start with the discussion of radial nerve. So here also we are going to discuss how it is formed. It's a branch of which part of the brachial plexus, its course, relation, branches and the clinical anatomy. So if I talk about the formation of the radial nerve, it's actually the continuation of posterior cord of brachial plexus. It's the largest branch of brachial plexus and it is formed by the ventral rami of C5, C6, C7, C8 and T1. So this is one of the largest branch of brachial plexus formed by the ventral rami of all these cervical nerve, that is C5, C6, C7, C8 and also with the T1 nerves. Now, so let me show you the radial nerve formation in this diagram. You can see here these are the posterior division of all the three trunks, and posterior division of all the three trunks will together join here to form the posterior cord, and one of its largest branch which is shown here is the radial nerve. So this is the largest branch. So here this nerve is formed by the posterior division of all the three cords which together forms the largest branch of the posterior cord, that is called as the radial nerve. So yes, so that is why it will have the root value of all the roots of brachial plexus, that is C5, C6, C7, C8, T1. Done. Now, let's talk about the further course of brachial plexus. When we are talking about the course, we will start with the discussion of the course starting from the axillary region. So, it is formed in the axilla and it descends behind the third part of axillary artery. So, its course is, it is traversing behind or posterior to third part of axillary artery. After that, it is situated, if it is exactly located anterior to which muscle? So, it is exactly located to the muscles which is forming the posterior wall of the axilla. We know that the posterior wall of axilla is formed by subscapularis, latissimus dorsi and teres major muscle. So, exactly it is located over and it is located anterior to, anterior to these three muscles. The muscles are latissimus dorsi, teres major and subscapularis muscle. It descends behind the third part of axillary artery and located anterior to the posterior axillary wall. So here you can see exactly, we can clearly see this is the axillary artery. So exactly we can see the axillary artery here. This is the axillary, AA for the axillary artery, and you can see here the radial nerve is located posterior to axillary artery. This is the radial nerve which is exactly, this is the radial nerve, and exactly radial nerve is traversing anterior to which all muscle? It is lying anterior to this subscapularis muscle, TM for teres major muscle and LD for latissimus dorsi muscle. So exactly you can see the muscles which is forming the posterior wall of the axilla. Over that and superficial to the posterior wall of axilla, the radial nerve is running. Now it will reach the arm. So it leaves the axilla and will reach the arm by passing through which triangular space? So it leaves the axilla by passing through a triangular space, that is the scapular region, gap in the scapular region from the posterior aspect, that is called as the lower triangular space. So it will pass along with profunda brachii artery. So in the lower triangular space, it is traversing and it passes along with, so here radial nerve is passing along with profunda, it is passing along with the profunda brachii artery. It is passing along with the profunda brachii artery. Now, see this. So, again I would like to enlarge this, and here I would like to show you this lower triangular space. So, if I enlarge it, you can clearly see the lower triangular space. The lower triangular space is the space which is lying on the posterior aspect of the scapular region. Here the nerve which is traversing here is the radial nerve, and the artery which is traversing here close to it and reaching the spiral groove is the profunda brachii artery, and this is the lower triangular space which is highlighted in this diagram. Thereafter, in the arm, it is located and it traverses between the long head and the medial head of triceps. Okay, so it is giving innervation to long head and medial head of triceps, and thereafter it will reach the level of spiral groove. So thereafter it will traverse the level of spiral groove across the posterior surface of the humerus lying between the two heads, that is the medial and lateral head of triceps muscle. So it thereafter will again come to the anterior compartment. So exactly it is firstly traversing through the posterior compartment of the arm and then it reaches the anterior compartment. So in that case it is giving innervation to triceps muscle. So exactly if we see this diagram here, we can see radial nerve traversing here. Radial nerve is traversing in the spiral groove along with the profunda brachii artery, the two structures, after passing through the lower triangular space. As you can see in the diagram, you can see the radial nerve, we can see the artery which is passing between the two heads of the triceps muscle, and it is located in the spiral groove of humerus bone in between the medial and lateral head of triceps muscle. Now, further, if I talk about the further course, what has been seen that it was going towards the anterior aspect of the arm. So it descends in the anterior aspect of the arm, it descends between the brachialis muscle and brachioradialis muscle. So exactly, actually brachialis, it is going between the brachialis muscle, which is a muscle of anterior aspect of the arm, and it is passing in between. So it is traversing between one of the muscles of anterior aspect of the arm and two of the muscle of extensor group, brachioradialis and extensor carpi radialis longus. So in this context, I would like to tell that these are the two muscle, BR for brachioradialis muscle and extensor carpi radialis longus muscle. So these are the two muscle which is directly getting innervation from radial nerve. So here brachioradialis muscle and extensor carpi radialis longus muscle is getting directly innervation by the radial nerve. Anterior to lateral epicondyle, and anterior to lateral epicondyle, it is giving two branches. One is superficial branch and the other is posterior introosseous nerve. This posterior introosseous nerve, in short you can write PIN. This is the deep branch of radial nerve. This nerve is the deep branch of radial nerve. So that means just anterior to lateral epicondyle, two branches are given. One is the superficial branch of radial nerve, another is the deep branch, that is posterior introosseous nerve. Now, exactly, let me just enlarge this image. You can see the radial nerve over the lateral side. So you can see radial nerve is traversing over to the lateral region in the elbow area, lateral epicondyle, as you can see here, and thereafter you can see it will reach the forearm. When it descends into the forearm, superficial, when at that level we have seen two branches are given, superficial branch and the pin nerve which will pierce the supinator muscle. The superficial branch, if I talk about the superficial branch of radial nerve, the superficial branch of radial nerve descends along the radial border of the forearm. What do you mean by radial border? Lateral border of the forearm, and will cross the anatomical snuff box. Thereafter it reaches the back of the hand. So it will cross the anatomical snuff box. Anatomical snuff box is a prominent, when you can see here just proximal to this thumb and the dorsum aspect, you can see here when you extend the thumb, you can see a prominent tendons which is forming the boundary of anatomical snuff box. We will also discuss this topic. Why? Because it's containing radial artery, and also superficial branch of the radial nerve is crossing the roof of anatomical snuff box. Now, so exactly you can clearly see here, if I am talking about, this is the deep branch of the radial nerve. You can see here the deep branch of radial nerve is traversing between which muscle? You can see here this muscle is the supinator muscle. Again you can appreciate, if I am talking about superficial branch, so here you can see this brachioradialis tendons has been cut, and the superficial branch, this is the superficial branch. So if I use this color for highlighting the superficial branch which is crossing the lateral aspect, is going towards the lateral aspect of the forearm, and ultimately in this diagram you can appreciate that it reaches the level of anatomical snuff box. So this is the region of anatomical snuff box which is crossed, the roof of anatomical snuff box is crossed by superficial branch of the radial nerve. You can also appreciate in this diagram the boundaries of anatomical snuff box. So this is extensor pollicis longus muscle which is forming posteromedial boundary. So this is posteromedial boundary of anatomical snuff box which is formed by extensor pollicis longus muscle. Here also we can see the tendons, that is extensor pollicis brevis and that of abductor pollicis longus. So these two muscle, extensor pollicis brevis and abductor pollicis longus muscle, these two muscles are forming AL for anterolateral border, and extensor pollicis longus is forming PM, that is posteromedial border. And you can see superficially it is crossed by the superficial branch of radial nerve. Now done with this. Now deeper branch, as in the diagram I have shown you, the deeper branch or the deep branch of radial nerve is piercing which muscle? Supinator muscle, and it will give it gives innervation to all the extensor group of muscle. It is very important to note that radial nerve is directly giving innervation to just two muscles. So that two muscles are ECRL and brachioradial. Rest all extensor muscles. Rest all extensor muscles. Extensor group of forearm muscle, all muscles are getting innervation from PIN. What is PIN? PIN is posterior interosseous nerve, that is the deep branch of radial nerve. So you can clearly see here, this is the posterior interosseous nerve, that is the continuation of the radial nerve, which will give innervation to all the extensor group of muscle. Extensor group of muscle. All extensor group of muscles are innervated by deep branch of radial nerve, that is posterior interosseous nerve. Now in this diagram, the summary of all the muscles getting innervation by radial nerve has been shown. So you can clearly see it is giving innervation